Hello and welcome to our YouTube channel. Today we are going to learn about Irritable Bowel Syndrome or IBS. Please subscribe to our YouTube channel, share it with your friends and watch the video till end to get complete information about IBS. IBS is a disease of our digestive system in which patients suffer from pain in abdomen, cramps and abnormal bowel movement. Our digestive system is composed of mouth, esophagus, stomach, small intestine and large intestine. The large intestine has different parts like cecum, colon and rectum. The walls of our large intestines are made up of muscles. Normally, these muscular walls contract rhythmically, called peristalsis. The content in our intestine travels toward rectum by peristalsis. The colon absorbs water and nutrients from partially digested food moving from it, while the remaining is called stool, which is stored in rectum. In IBS, the contraction of colon will become abnormal. Now let's talk about signs and symptoms of IBS. Diarrhea, constipation. Constipation alternating with diarrhea. It means that sometimes you would suffer from constipation and then diarrhea. Belly pains and cramps, usually in lower half of belly, that get worse after meals and feel better of bowel movement. A lot of gas or bloating, harder and looser stool than normal, a belly that sticks out, mucus in your poops, feeling like you still need to poop after you just breathe, food intolerance, tiredness, anxiety, depression, heartburn and indigestion, headache. Now let's talk about the causes of IBS. There are certain factors that may lead to IBS. Muscle contraction in intestine. The wall of the intestine aligns with the layer of muscles that contract as they move food through your digestive tract. In some cases, the contractions may cause the food to move too quickly through your colon. As a result, your colon will not have enough time to reabsorb water from food. This condition leads to watery stool or diarrhea. It is IBS type D or IBS with diarrhea. In some cases, the contraction may cause the food to move too quick slowly, so your colon will absorb too much water and hardened stool will be formed and constipation will occur. It is IBS type C or IBS with the constipation. Nervous system. Abnormalities in nerves in your digestive system may cause you to experience greater than normal discomfort. When your abdomen scratches from gas or stool, poorly coordinated signal between the brain and intestine can cause your body to overreact to change that normally occur in the digestive system, resulting in pain, diarrhea or constipation. Severe infection. IBS comes developed after severe bout of diarrhea caused by bacteria or a virus. IBS also be associated with the surplus of bacteria in intestine. Early life stress can cause the symptoms of the IBS. Weak immune system may also lead IBS. Next, how IBS is diagnosed. If you have been having uncomfortable GI symptoms, see your healthcare provider. The first step is diagnosing IBS with medical history and physical exam. Your provider will ask you about your symptoms. Do you have pain related to bowel movement? Do you have noticed change in how often you have bowel movement? Has there been a change in how your food looks? How often do you have symptoms? When did your symptoms start? What medicine do you take? Have you been sick or had a stressful event in your life recently? Depending upon your symptoms, you may need other tests to confirm the diagnosis. Blood tests, stool samples, X-ray can help rule out other diseases that mimic the IBS. Prevention. First is dietary change. Increase fiber in your diet. Eat more fruits, vegetables, grains, and nuts. Add supplement fiber to your diet. Drink plenty of water. 8 ounces per day. Avoid caffeine, coffee, chocolate, tea, or sodas. Limit cheese or milk. Lactose intolerance is more common in people with IBS. Make sure to get calcium from other sources such as spinach, salmon, broccoli, or supplement. Try to low FODMAP diet and eating plan that help improve symptoms. Activity changes, exercise regularly, don't smoke, thyroid relaxation technique, eat smaller meals more often, record the food you eat so you can figure out what the food trigger IBS flares out. Common triggers are red peppers, green onion, red wine, wheat, and cow's milk. What type of complication can be occurred? Chronic constipation or diarrhea can cause hemorrhoids. In addition, IBS is associated with a poor quality of life, mood disorder. Poor quality of life. Many people with a moderate to severe IBS report poor quality of life. Research indicates that people with IBS miss 3 times as many days of work as do those without symptoms. Experiencing the signs and symptoms of IBS can lead to depression or anxiety. Depression and anxiety also can make IBS worse. Now here is the quick summary of IBS. Causes: stress, anxiety, depression, change in gut microbiota, genetic symptoms, constipation, diarrhea, abdominal pain, gas or bloating. Treatment: avoid trigger food, regular exercise, and medication.